Here at 9:22, we're going to switch gears for a moment right now and take this moment to discuss a lung disease that is affecting tens of thousands of Americans, yet most people have never heard of it. Non-tuberculous mycobacteria, or NTM lung disease, a progressive condition that's often mistaken for asthma, COPD, even bronchitis. Amy Lightman, president of NTM Info Research, a national nonprofit dedicated to supporting patients with this condition, joining us live here on the Zoom right now. Amy, good morning. Thanks for joining us.
Good morning. Thank you for having me.
And Amy, let's start with the basics. What exactly is NTM disease? Why should our viewers know about it?
So NTM, or nontuberculous mycobacterial disease, it's a lung disease that affects over 200,000 Americans every year, and it's growing at 8% a year in the U.S. So it's a growing health issue. There are a lot of different factors that make somebody vulnerable to it, so it's important for people to know about it. It's often misdiagnosed, so it's important for people to know the symptoms of it and to know, when should they start asking about getting tested for it. Those are the most important things, really. NTMs are, environmental pathogens. We're surrounded by them. They're in the soil and the water. Most people aren't affected, but if you have an underlying vulnerability, you can get sick with it.
Why is this disease flying under the radar, and what's driving the increase?
So I think it's flying under the radar a lot because, number one, it is mistaken for other things, and number two, there was this perception previously that it really was pretty rare. The thing is, when you look for it, you're going to find it, especially when the symptoms match. Why is it on the increase? There's a number of factors. We have an aging population. As we age, so do our immune systems. There's more use of immune suppressive drugs to treat conditions that are, immune dysregulated, like rheumatoid arthritis, psoriasis, etc. They're great treatments for, other diseases that cause a lot of suffering, but they do, suppress the immune system. And anything that suppresses the immune system is going to have an effect and make somebody more vulnerable to an infection like this.
So what are some of the warning signs, and where do you know that it's not asthma or just a cold?
So you're going to know if it's not asthma or just a cold if it keeps coming back. You're going to, if you're getting treatment and it's not responding to treatment. And the most common symptoms are fatigue, cough, and shortness of breath. People also get night sweats, low-grade fevers. They could lose weight. That persistent cough is one of the more, hallmark symptoms, along with the fatigue. Those are the key symptoms that get reported most often by patients.
What do you suggest on advocating for proper testing, and what is the typical journey a patient would expect to go through?
So, I think a typical journey is going to start with, probably, with these symptoms showing up and thinking it's something else. When it doesn't respond to treatment, that's when you say to your doctor, something else is going on because this isn't working. That's, really when you ask, can we do a CT of my lungs and see what's going on in there? If you have somebody who's coughing up sputum, if they're bringing mucus out of their lungs, that mucus needs to be analyzed. It needs to be looked at a lab to see what's in it, what grows out from it. There are specialized labs that look for specifically for NTM, and they can tell you which species of NTM is growing. And that's really important as well because there are different treatment protocols. But it's, the tests aren't that complicated. You just have to think to ask for it. And so really it's a matter of being aware of, okay, the treatments I'm on aren't working. What's next?
And what kind of damage, if left untreated, can people experience?
So it just causes more lung scarring, and that makes breathing harder. Your oxygen's going to suffer for it because you're going to have less functional lung tissue. We have a saying that time is tissue. So, the sooner you get diagnosed, the better it is.
All right. World NTM Day is August 4th. What are you hoping to get your message out to, or what are you hoping to accomplish then?
So we really want to help boost the message about, the symptoms, about earlier diagnosis, about proper treatment, about the importance of patient support as well. Our organization offers a robust patient support network, so we are here to help patients. There's a lot of educational materials available. If you go to worldntmday.org, there are webinars that we're hosting that you can sign up for free. There's links to all kinds of information. There's also links to different social media, toolkits and social media posts that you can help us by, posting them and boosting the message for us.
All right. Amy Lightman, president of NTM Info and Research. Thanks for joining us this morning. Great information and a message for patients to look at themselves and advocate for good health. Thanks, Amy.
Thank you so much. Thanks for having me.
Absolutely.